How can fMRI results be interpreted more clinically? Imagine trying to understand a busy city by looking at a single street map. That's similar to how doctors interpret functional magnetic resonance imaging results. It's not just about seeing which parts of the brain light up, but about making that information useful for real patient care. To do this, we need to improve how we analyze and connect the data to what's happening with the patient. First, it's important to remember that functional magnetic resonance imaging measures brain activity indirectly. It looks at changes in blood oxygen levels, called the blood oxygen level dependent signal. When a brain area is active, blood flow increases to that spot, but this response is slower than the actual neural activity. So, understanding this delay helps in making more accurate clinical interpretations. One way to do this is by using advanced data analysis techniques. Instead of just looking at one region at a time, sophisticated models like the general linear model compare expected blood flow responses with what the scan shows. This helps identify which brain areas are truly involved in a task or process. More complex methods like machine learning can detect patterns across many regions, revealing subtle changes that might be missed otherwise. These tools are especially useful when diagnosing or tracking neurological and mental health conditions. Another approach is analyzing how the brain functions over time, not just in static snapshots. Resting state functional magnetic resonance imaging looks at spontaneous brain activity when a person is not doing any specific task. This helps map out brain networks and see how they connect. Changes in these networks can tell us a lot about recovery after a stroke or shifts in mental health disorders. Clinicians also combine functional magnetic resonance imaging data with other information. For example, they look at patient symptoms, cognitive test results, and physiological data. This combined view makes the imaging results more relevant and helps tailor treatments to each individual. Improving imaging protocols is another key step. Using optimized sequences like gradient echo-echoplanar imaging increases the sensitivity of blood oxygen level dependent signals. Careful preprocessing reduces noise and artifacts, which makes the data more reliable for clinical decisions. Some clinics also use multimodal imaging, combining functional magnetic resonance imaging with techniques like electroencephalography or magnetoencephalography. These methods have higher temporal resolution and help capture both where and when brain activity occurs. This full picture supports better diagnosis and treatment planning. In practical terms, functional magnetic resonance imaging is used for brain mapping before surgery. It helps identify critical areas to avoid during operations. In mental health, machine learning algorithms analyze resting state data to help distinguish disorders like depression. For stroke patients, dynamic analysis tracks how brain activity changes during recovery. By applying these strategies, we turn complex imaging data into clear, actionable information. This makes functional magnetic resonance imaging a more useful tool in everyday clinical practice. It helps doctors make better decisions, plan treatments more accurately, and ultimately improve patient outcomes.